Welcome to Katzen Eye Care and Laser Center, a tradition of eye care excellence in South Florida. From exciting advances in LASIK laser vision correction to recent breakthroughs in cataract care, the world of ophthalmology is evolving right before our eyes. This is especially true for one of the biggest segment of today's population, people in their 40s, 50s, and 60s, who can no longer read up close and are tired of looking older than they feel in their drugstore readers or bifocals. If you're among this group and are visiting us for a LASIK evaluation, you may discover you are a better candidate for our refractive lens exchange procedure known as RLE. There are three common reasons why someone would consider RLE over other refractive procedures. You desire to be less dependent on glasses or contacts for far and near vision. Your vision is outside the corrective range of LASIK and other refractive procedures. Or your eye's natural lens shows signs of clouding or early cataract formation, even though this clouding is not interfering with vision. In fact, people who have RLE will not need cataract surgery in the future.
Hi, I'm Dr. Lawrence Katzen, and I'd like to personally thank you for visiting the Katzen Eye Care and Laser Center today. Many of our patients first come because they think that LASIK is the best procedure for them. In fact, the refractive lens exchange procedure is an alternative for many of our patients, especially those who have already developed the need for reading glasses. Many of our patients who come to the office for LASIK are initially disappointed and shocked that they are a better candidate for refractive lens exchange. In the end, they find out the benefits of this procedure and are happy and satisfied with the ability to achieve both distance and near vision.
I am so glad that it turns out that I was not able to have LASIK. I'm glad that it turned out that way for me, because having the refractive lens now, knowing I will never ever get cataracts. I know this sounds corny. The price for what this has given me, it's priceless.
I didn't think I was going to be a candidate for LASIK, but I didn't know what, if anything, was available, because I never heard of this. That you can correct near vision, and it's not LASIK, until I came to see Dr. Katz, and he explained the lens exchange as common it is with cataract patients. I can't believe that you don't hear more about this procedure as you do about LASIK. I can't believe it, because it is remarkable that you come in with your glasses, you need them to fill out the paperwork, you put them away, and they're done. It's perfect, and I can see.
As one of the leading refractive surgeons in his field, Dr. Larry Katzen has helped thousands of men and women make the right choice for their vision correction needs. Our goal today is to help you make a more informed decision about your vision by illustrating the difference between LASIK laser vision correction and an RLE procedure.
Our goal at the Katzen Eye Care and Laser Center is to determine which procedure is the right one for you. Each person is an individual with a distinct lifestyle and distinct visual needs. Because we have the ability to perform a multitude of procedures, we are in a very good position to select the best procedure for you. Our practice is not limited to LASIK, and it is not limited to lens implant surgery. We perform all of the refractive procedures and are able to select the one that best fits your lifestyle.
The easiest way to understand our RLE procedure is to have a better understanding of the eye. The main two areas of the eye that help us focus are the cornea, or outer layer of the eye, and the lens inside our eye. LASIK is performed on the outer surface of the eye. Using non-thermal beams of light, our excimer laser is used to gently sculpt the cornea with quarter-micron precision to reshape this outer layer with your individual prescription. This helps to refocus your vision, much like a contact lens would. This cornea correction is permanent and will help you see well at distance until changes occur to the lens inside your eye as a result of the natural aging process. As the lens in our eye ages, it starts to become dysfunctional and loses its ability to help us focus at near and distance. This is known as presbyopia. This normally occurs in our 40s and 50s. If left uncorrected, this lens will continue to harden and yellow, resulting in a cataract. Patients in their 40s, 50s, and 60s having LASIK will experience these changes in their lenses. Eventually, glasses or contact lenses may be required for both near and distance vision, and the use of bifocal and even trifocal lenses becomes necessary as years go by. To avoid having presbyopic patients undergo 2 vision correction procedures, Dr. Katzen recommends RLE to patients in this age category. By replacing the eye's aging lens with a premium intraocular lens implant, or IOL, these patients will never develop a cataract.
A major advantage of the refractive lens exchange is that they will never develop cataracts after undergoing this procedure, because it actually removes the lens of the eye in which the cataract forms. When a patient undergoes LASIK, they will of course eventually develop cataracts and will need to undergo the cataract surgery. So this is a major difference between the 2 procedures. We want our LASIK patients to understand that if they have LASIK, in the future, they will develop the need for reading glasses if they haven't already, and then will subsequently need cataract surgery. Our patients who undergo the refractive lens exchange are able to reduce their need for both distance and reading glasses and will never develop a cataract.
I don't have to reach for glasses. I don't have to move the computer. And in fact, in the context of the computer, I was having backaches because I was leaning forward at the desk to look at the writing on the screen. I don't have to do that now. I can lean back in my chair and read the computer.
There are a number of new and exciting FDA-approved IOLs recommended by Dr. Katzen that can be tailored to fit your lifestyle. These include multifocal lenses to help you see at both near and far, toric IOLs to help correct your astigmatism, and night vision IOLs to improve your night driving. Having a multifocal lens implant creates a new visual system inside the eye, one that can provide you with the focusing power or range of vision to see near, intermediate, and far images with minimal dependence on corrective lenses. Monofocal lenses, on the other hand, provide clear vision at only one point of focus. Reduced dependence on corrective glasses can be achieved with monofocal lenses when one eye is corrected for near and one for distance. Surgical monovision is a viable option for some patients, but not tolerated well in other patients. It is rarely recommended for patients who have not previously been happy with it using contact lenses. To perform RLE, your eye is completely numbed with topical or local anesthesia. The eye's natural lens is then gently vacuumed through a tiny incision, about 1/8 of an inch wide. Next, the multifocal lens is folded and inserted through the same micro-incision. It is then unfolded and placed into the capsular bag that originally surrounded the natural lens. This incision is self-sealing and usually requires no stitches. It remains tightly closed by the natural outward pressure within the eye. This type of incision heals fast and provides a much more comfortable recuperation. If you have pre-existing astigmatism, your surgeon may elect to make micro-incisions in the cornea to reduce your astigmatism. These are commonly called LRIs, or limbal relaxing incisions. You will go home shortly after the surgery.
Following the procedure, which took only a few moments, and I'm not kidding, Dr. Katzen said, "Okay, Sybil, sit up. You're done." And I said, "What?" He said, "Sit up." I sat up, and across the room, on the wall, was a sign with a few directions for the operating room nurses. I could read it. I will never forget that moment as long as I lived. It was miraculous.
There has truly never been a better time to be considering vision correction at Katzen Eye Care and Laser Center. The vast majority of all of our vision correction procedures are performed using only topical eye drop anesthesia. This allows our patients to enjoy a much quicker visual recovery and a faster return to their normal daily activities. From LASIK and RLE to modern-day cataract surgery, Most of our patients are able to drive within 24 hours of their procedure. Thank you for your faith and trust in our abilities.